So, I'm happy to introduce our first open conversation from the Circle U Climate Hub and the Circle U Global Health Hub. Today is Earth Day, 22nd of April. So we're not just here in this audience, but we are sort of, so to speak, spread across the world. It's an initiative which started in 1970 already, first in the United States exclusively, then it became an international enterprise, and the motto for this year's Earth Day is "Our Power, Our Planet." We are linked here now in a technically highly complex enterprise too. We have two sides. Here we are in Berlin. We have colleagues who are in Louvain, and we have another colleague who is in Antwerp in Belgium. My name is Pascal Grosse. I'm a neurologist and historian here in Berlin at the university hospital called Charité, and I'm an academic chair for the Circle U enterprise for the topic of global health. As said before, it's a joint endeavor today because it's between an enterprise, initiative between the Global Health Hub and the Climate Change Hub. It's a little bit now like the European Song Contest because I have to check now whether everybody's on board. So I'm now calling Louvain. Louvain, are you there? Can you hear me?
Yes, of course. Ready to give 10 points.
Okay, very good. So, 12 points. Then we have a colleague in Antwerp, Wim van Bortel. Wim van Bortel, can you hear us? Are you there?
Hello, good morning. Hello, good morning. I hear you very well, thank you.
Thank you very much, and thank you very much for being on board in this enterprise. In this, we start with students' comments on topics of our experts. Here in Berlin, we have one expert, Catherine, who is a nutritionist and has something to say about One Health. To her left, from my side and from the public side, we have Anna Deschanzreiter, who is a student of medicine, a bachelor in ethics, global health ethics, and she will comment on the work, on the topic of Catherine. In Louvain, we have also a student, Emma Bindler, who is a student of psychology, and we have an expert next to Wim van Bortel, who's one of our experts, another expert, who is Cyril Caminade. And I now hand over to Louvain because Pietro is introducing the topic of One Health to the audience. Thank you very much. Pietro, it's your turn.
Thank you very much, Pascal, for the introduction. Yes, I will actually start from the idea that sparkled this open conversation. Within Circle U, the work is somehow clustered about some topics. One of these is global health, one of these is climate, and we thought that it would be mutually interesting for people interested in global health, so how inequalities in health can shape our fruition and our perception of health. And people working in climate and the impact of climate on our life, it would be actually interesting for both of us, of our group, to talk about what the topic of One Health. That is to say, the topic of the health of us as a species, but also of all the animals that are around us, and also by extension, to some extent, to something that is called planetary health. That is the idea really that is just one health of one big macro organism or macro system that is our planet. Indeed, really, the idea of One Health comes from the connection, from the fact that we are not an isolated species. So, for example, every intervention that we may have on humans also have an effect on all the other species that are connected to humans to some extent. And this could be animal species, could be vegetal entities. And of course, we can really see that because to some extent we are all exposed as humans, as all animals and as plants to the big issue of climate change. And climate change affects, let's say, independently all of us, but also has a global effect that is to some extent changing how the different species interact with each other. And we will see that with our three experts that will focus, let's say, on that have three different angles on this topic. That is the one of plants, that is the one of climate, and there is the one of entomology. So let's say mostly vector of diseases to have a direct connection to health. And I think that we can then start with some reflections on the work of the three experts done by the different students that have interpreted, let's say, their work and given a sort of summary. And then, of course, each of the individual experts will have the chance to reply or add some topics, add some reflections to what has been said about their work. I would then give the floor to Emma, that will start the commenting on the work of one of the two experts.
Oh, thank you so much. Sorry, Pietro. So in 2009, Greece was hit by a severe economic crisis. The same summer, temperatures reached record highs. The combination of budget cuts, heavy heat, and increasing migration led to perfect conditions for disease transmission. And for the first time during the 21st century, malaria reemerged on the European soil, which is exactly the kind of scenario that Cyril Caminèd's research help us understand and anticipate. So please welcome Dr. Caminèd here today with us. He is a multidisciplinary scientist, trained as an applied physicist and climatologist. And his work has been both focused on human and animal health issues. He develops models that simulate changes in temperatures and rainfall, both factors that drive the spread of infectious diseases. His research has demonstrated the impact of climate change on vector-borne diseases and what that entails for the future. So vector-borne diseases such as malaria and chikungunya are transmitted by small creatures called arthropods, which are creatures like mosquitoes or ticks. And these creatures have internal activity that is directly driven by their external environment, which means that factors like increasing temperatures or humidity increases directly their biting rates and their chances of survival. This is why these diseases have historically been concentrated in subtropical and tropical areas in the world. However, Cyril Caminèd's research highlights that climate change is altering this balance, bringing these diseases to regions that were previously unaffected by them, including parts of Europe. However, this shift is not limited to Europe. Indeed, increasing temperatures, increase in rainfalls, and the rise of humidity is also leading to the expanding of the conditions favorable to the transmission, and the consequences are visible across the globe. So, for example, in the sub-Saharan Africa, these conditions have contributed to the re-emergence of malaria. In the Anhui province in China, the combination of heat and humidity has created a near-perfect environment for transmission. In North America, for example, the triotamine bugs, which are responsible for the spread of Chagas disease, are also appearing in regions where they were previously unknown. Beyond geography, Cyril Caminèd's work also highlights a deeper challenge, which is that the populations that are most affected are often the most vulnerable ones. For example, poorly constructed housing, limited sanitation, fragile healthcare systems, all point to low-income communities that are disproportionately exposed to those outbreaks. So when those outbreaks hit, they don't just affect health, they also affect productivity, development, and economic stability. So hence we can say that climate change and infection diseases together form a feedback loop that deepens existing inequalities. This is the reality that your work, Dr. Kamenet, is mapping, and it raises a fundamental question about how we respond. So your research shows that animals, climate, human health are all deeply connected. Do you think that the One Health approach is truly put into practice today when it comes to responding to these diseases? And if not, what would need to change according to you?
That's a very good question. And thanks, Emma, for the introduction. Can you hear me okay, everybody? Yeah. So it's back to the start on this, I think, event of the global health climate. That's quite interesting because I was a climate scientist and I became a lightweight epidemiologist or geographer of health in the meantime. So it makes full sense with what I've been doing over the past 15, 20 years of my life. So it's nice being here with you today. And thanks for the pitch and the introduction, Emma. For the One Health, that's a difficult question because One Health has always been a very philosophical issue. I mean, Jakob Zinstag and others have been defining the terms, been refined over the years for the health of the environments, connected to the health of our animals, connected to our health. That makes sense. But in practice, it's not that straightforward. And there's been One Health before One Health existed, if you think about it. Some example of the Kuro disease, when the veterinarians were working with the virologist, they discovered the prion. There was a prion type thing in Papua New Guinea. So there's been One Health before One Health existed. Some diseases might fit the One Health concept, others less too. So it depends on the disease you're focusing on. If you think about vector-borne disease, here usually it fits the One Health concept because you're going to have hosts like animals, can also hosting like West Nile, for instance, is a real One Health issue in Europe right now because blackbirds can be infected, horses are dead-end hosts, humans can be affected too. And the whole system obviously involves mosquito of the Culex genera transmitting the disease, but obviously you need all those components to transmit disease to humans if you want to, in ideal conditions. So you're going to get hotspots in forested areas, we've got more blackbirds usually. It can also happen, the Spanish use horses, for instance, to track infection sometimes as sentinels. So I think it makes a lot of sense with the problems we're facing now. There's another example of Rift Valley fever in East Africa, for instance, where the Kenyans have been using sentinel animals. They keep animals, livestock, naive to infection, because if you survive infection, you can also develop immunity to disease, which makes a difference. And they've been using those to basically try to anticipate outbreaks. So you use basically your animals to anticipate what's happening. Spanish have been doing the same with horses. There's also another interesting thing that's been done in Bordeaux with xenomonitoring, for instance, when you basically trap mosquitoes and you look at the excreta, so mosquito poo-poo, basically, and check if you find virus in there. And this can also trigger early warning. So that's kind of all these activities, and there's a lot of research being done right now that's quite practical, fitting the One Health concept. I won't say One Health is applied systematically for all problems. I mean, if you've got nosocomial infection in hospitals, you don't really care about the animals around or the environment's more an internal issue in your hospital. But for, let's say, emerging issues and also for tropical diseases, especially of the African continent, South America, Southeast Asia, it makes a lot of sense. So that's more my good feeling about it. And to get back to the point you mentioned before, I want to also underline we've been moving things for centuries, and Pascal is historian, so you know about that, which means that when you got those new mosquitoes, new bugs, or new malaria cases in Europe, it's because people moving in. In malaria, basically we get rid of malaria post-World War II, creating an issue of DDT, insecticide resistance, etc. But the level of parasite in the environment is very low. So you need people to come back infected to reintroduce the parasite for the mosquito, the Anopheles mosquito, to being able to transmit disease. Same with the Asian tiger mosquito, and Vim can develop afterwards. The mosquito was in Asia. He didn't fly because of climate change. He came with us in containers, been traveling global shipping, so it's a globalization issue. So if with COVID too, started in China, it was widespread over the globe very rapidly because of air travels, people moving the things. So movement of host and people always been critical in history for moving disease, especially in a region where people never been exposed. Native Americans, I mean, the list is huge, if you remember your history books. That's one point I wanted to make. And then also, there's a point I think it's going to connect to the other expert in Berlin. When you mention vulnerable people, there's also a vicious chain with undernutrition, food security. So climate change can also issue your food, can also cause problems with local agriculture, sustenance agriculture, which means people are weaker and more prone to infection. And we see it causes like a lot of problems. There was an example in Burundi a few months ago, new disease emerging. So that's me, I think. I hope this answered your question.
Yeah, thank you so much for your answer.
Thank you.
Thank you very much. We will also have the chance to elaborate on each other's questions and develop some aspect that maybe have been, really not really dug into now. I think that we can then move to Berlin to continue the discussion.
Perfect. Thank you so much for the transition as well. That was a great lead up to the next topic, where we'll be talking about climate change and nutrition and health. And I have the pleasure of being here with Professor Caroline Stokes. So I'm just going to provide a little summary of her work, a commentary, and then please note any questions that you guys have so that we can discuss them later. All right. In 2022, a landmark study published by Nature Climate Change found that climate change had already driven the worsening of 58% of human infectious diseases worldwide. That same year, the UN Food and Agricultural Organization warned that shifting rainfall patterns and rising temperatures were quietly eroding the nutritional quality of the crops that feed the majority of humanity. Two crises unfolding simultaneously, and yet in most medical curricula, they are still treated as separate problems if they are treated at all. This is precisely the intersection that Professor Dr. Caroline Stokes' research forces us to confront, and which we will explore together in this open conversation. Professor Stokes trained in the United Kingdom before completing her postgraduate diploma in dietetics at King's College London and a PhD in clinical nutrition from Saarland University. She is today professor of food and health at Humboldt-Universität here in Berlin. In her research, Professor Stokes places the gut microbiome at the center of the conversation. As a medical curiosity, a bridge between human health and the broader environment, and a key player in the One Health framework. Her research shows that diet quality shapes the microbiome, and that diet quality is itself inseparable from soil biodiversity, agricultural practices, and food systems. A healthier, more resilient microbiome builds resistance to disease and helps counter antimicrobial resistance. But crucially, this logic does not stop at the human body. The soil microbiome functions for plants much as the gut microbiome functions for us, enabling nutrient processing, supporting immune defense, and determining resilience under stress. Health ecosystems and healthy bodies in this framework are not parallel concerns, but rather they are the same concern viewed from different angles. Her work also turns a particular lens on vitamin D, a micronutrient whose production is directly shaped by environment and lifestyle, whose deficiency is widespread, especially in urban populations, and whose potential plant-based sources remain largely unexplored. Across all of these threads, a single principle, I think, holds true. Human health, plant health, and environmental health are governed by interconnected systems, and understanding one requires understanding the others. This framework matters urgently right now. What we eat is not separable from where our food comes from, and where our food comes from is changing. Elevated CO2 levels are measurably reducing the protein, iron, and zinc content of staple crops like wheat and rice. The Harvard University Center for the Environment communicates foreboding implications. By 2050, hundreds of millions of people could fall below the minimum nutritional threshold needed to maintain good health, and a further 2 billion already deficient could experience worsening conditions. And in keeping with the One Health perspective, this crisis extends well beyond human nutrition. Every animal in the biosphere depends in some way on plants for nutrients. Plant health, too, is at risk. Prolonged droughts are constricting the range of plant diversity, increasing pest and disease pressure, and altering plant physiology under mounting environmental stress. Meanwhile, the human populations most exposed to these shifts, communities relying on subsistence agriculture, those with the least access to dietary diversity, are the same populations already carrying the highest burden of nutritional disease. Climate change and malnutrition, similar to climate change and infection, create a compounding burden that the most vulnerable communities are least equipped to absorb. in conclusion, on a recent visit to the Orto Botanico in Padua, one of the oldest botanical gardens in the world, I came across a text that stopped me. It read, "We think that we have domesticated them, when in reality it is they who have domesticated us." Talking about plants here. For 450 million years, the text continued, they have been the pillars of the Earth's ecosystem. Our food, our medicines, our very capacity to breathe, all of it flows from them. This is, in a precise biological sense, what the human-plant microbiome describes. Professor Stokes's work highlights a crucial relationship. We are not separate from the plant world, we are downstream of it. And as climate change reshapes that world, it reshapes us, our gut flora, our nutritional status, and our vulnerability to disease. This is the terrain that Professor Stokes's research is mapping, and it raises a question that goes to the heart of today's event. Professor Stokes, your work shows that the gut microbiome, the soil microbiome, diet, and planetary health are all part of the same living system. As climate change accelerates the disruption of this system, what do you see as the most urgent challenge for your field and for the medical thinking more broadly?
So thank you very much for the question. I think I would say the most urgent matter is stability, that we want stability in our ability to handle resilience against disease, adversity. We spoke previously about this rise of infections, of diseases, and I think the core is that the host, be it a plant, an animal, a human, the environment is able to remain resilient and withstand the insults that are coming our way. One such way is the microbiome. We know that a rich and a diverse microbiome can help to increase this stability. We know that in plants we see the same thing, that the microbiome can affect the resilience of the plant to stressors, to outside stressors. And they have this commonality that usually in my field of research, we think about the human. We think about nutrition, we think about what's needed to keep the human being healthy, but when we start to draw parallels beyond, we see that there's actually a lot that we have in common, and the microbiome is one of those things. Vitamin D also is another one, because we know that vitamin D has strong anti-inflammatory and immunological effects. Historically, the emphasis has been on vitamin D for bone health. And this is the core, let's call it, role that vitamin D has. But at the same time, it's an essential vitamin and we cannot obtain it from food. So we rely on sunlight for vitamin D, and with the changes that we're seeing in the climate changes and the intensity of the sun and the risk of skin cancer, there's this move away from spending time exposed to the UV rays, and so vitamin D deficiency is very prevalent. Many people do not want to simply spend a lot of time in the sun for that reason, and so we rely on other sources of vitamin D, but a dietary source isn't a strong source of vitamin D, and this is the trouble, that you cannot say to people, right, you know, if you don't have sufficient sun exposure, you have to rely on your diet. We have very few foods which we would call everyday foods that you can eat for sufficient vitamin D, and then the questions about supplementation and should it be supplemented. It's a very, very controversial area. We don't know enough, I think, about vitamin D yet. There's a lot of unexplored areas. There's a lot of positive studies, negative studies. 1 minute it's criticized, 1 minute it's praised. So I think it's an emerging field, as is the microbiome. They're both areas where every week we're discovering new things, we're understanding more, and at the core of it is how can we become more resilient to disease.
Okay, thank you very much for this sort of introduction. And we're now going back to Louvain. Emma, I think it's your turn again.
Can you hear me? Yeah. Thank you so much. So now I'm going to comment a bit on Wim van Wortel's work. So first of all, welcome, Wim van Wortel. He's a medical entomologist and PhD at the Institute of Tropical Medicine. He has spent over 30 years investigating the factors driving the transmission and the spread of vector-borne diseases across Europe, Africa, and Asia. And today in Belgium, the tiger mosquito isn't just a distant threat anymore, it's actually settling here. Which his research points to the increase of temperatures, making the local climate increasingly suitable for Aedes albopictus, which is more commonly known as the tiger mosquito. So it's establishing itself more permanently here in Belgium. And what was once a seasonal presence is now becoming a year-round reality, extending transmission windows and raising risk of local outbreaks of diseases such as dengue or chikungunya. But Van Bordel's work also takes us to a very different context, the Democratic Republic of Congo. There, the same vector, the tiger mosquito, drove the first recorded chikungunya outbreak in Matadi, a port city in western region of the DRC. The disease arrived abruptly in the population with no prior immunity, no preparation. And the first cases that were recorded as far back as in 1998. 2 years later, in 2000, 50,000 cases were recalled. Yet in 2019, the new wave emerged. When a new wave emerged, the government failed to declare an official outbreak, and that left the healthcare professionals without any guidance and the population without any information. Therefore, the consequences were severe. The healthcare professionals who were unfamiliar with chikungunya defaultedly treated the patient as malaria cases, even though the test came back as negative. And this led to a widespread of mistreatment and of unnecessary medication. Additionally, the financial costs were especially high. The treatment costs could reach $45 per patient in a country where the majority of people lives under $1.90 a day. So what Van Bordel's work here really makes clear is that the climate change isn't just creating a new environment for diseases to thrive, it's really exposing the fault lines in our health systems. Additionally, controlling vector-borne diseases requires surveillance, modeling, and testing. And these tools come at a great cost, especially for low-income countries that cannot often bear that alone. Without them, as I just said, with the example in the DRC, outbreaks that could have been anticipated become crises that are impossible to contain. And this is precisely where the One Health approach becomes essential, because the link between environmental change, animal vectors, and human health cannot be addressed as a single sector alone. So my question to you, Dr. Van Bordel, your work on diseases like malaria, chikungunya, or Rift Valley fever has taken you from Belgium to Rwanda to the DRC. How does the One Health approach concretely shape the solutions that you identify for the prevention and the control of these diseases?
Okay, thank you, thank you very much for this nice introduction and this overview of the work I'm doing. Indeed, climate change is very much shaping part of the vector and vector-borne diseases that we discussed, like you called malaria, like you the chikungunya, dengue, these type of diseases. And in the beginning, I think from looking to One Health and starting the One Health, it was often considered important for zoonotic diseases where you have reservoirs, where you have animal reservoirs, but looking more to One Health and planetary health, I think it also applies to these more anthropogenic diseases where we don't have an animal reservoir or a need for an animal reservoir like dengue or chikungunya, where we as humans are shaping our environment in a way that that is favorable for mosquitoes. And if you, for example, look to a couple of countries where I work in Africa, where waste is really a problem, and waste is part of the problem just for humans because they don't get rid of their waste, but the waste is also a problem in terms of creating the suitable conditions for these mosquitoes. So in that sense, it's also a One Health problem, these anthropogenic diseases where we don't have enough attention for the environment in which we live, for the way we create environments and shape environments that are suitable for mosquitoes. And for me, that's one part of the equation that we need to take into account if we talk for these diseases on One Health. Another part is, of course, and that's more difficult one, is also to use in control methods that are not harmful for the environment. Much of the control methods are currently based on insecticides for good reasons. I would not say, for example, for malaria that we will stop implementing long-lasting insecticidal nets. I think the gain that we had on malaria control in Africa is largely due to the long-lasting insecticidal nets, but I think as researchers we need to have a view on how can we move to maybe non-insecticidal interventions and control methods. These are points that we are trying to address in research that we are doing in Belgium, but also in DRC, looking to how we can use traps to get rid of mosquitoes, or how, and I think that's part of the work of a medical entomologist. I'm a medical entomologist also, to say how can we better target the intervention so that at least we reduce or limit the harm of the system. So that's for me, in terms of control, points that we have to take into account. And then a general comment, but I think it's also commented by Cyril. And for example, you mentioned in the first example, Greece and malaria. It is, for me, at least, it was also a socioeconomic problem where the labor force changed from people from neighboring countries, from people from the Indian subcontinent. So where the parasite was brought into the system, a system where vectors were still present and probably where malaria transmission still could occur. So that's also a plea for looking very much broader and looking to the different drivers. Climate is important, but that we look really much to different drivers and factors that shape vectors and vector-borne diseases.
Thank you so much.
So thank you to the students, Emma and Anna. Thank you to our experts. And I think we got already quite a good notion that health is not just human health, that there is one health which entails various dimensions. And these are 3 examples for that. There are many more topics, of course, but this is a very good selection. And our experts represent all different disciplines. No discipline is directly linked with medicine, but it influences highly how medical thought could be developed further. So now we turn this rather closed conversation to a much more open conversation. We are opening the floor to questions, comments to the audience which is here with us in the virtual space. So once you want to comment or ask a question or whatever, please switch on your camera so that we can actually see you. Is there anybody going to start? And just speak to the audience. Nobody? So just collect yourself. So we start with another question from Anna.
Yes, I actually had a question for the experts in Louvain and Antwerp. So I recently went to an exhibition where we were talking, or it was all about how to use animal tracking devices, I guess, kind of to observe movements, geographic movements, but also maybe get hints for what climate change is doing and where it's forcing animals to go. And I was wondering if that is at all a method that is possible to be used with mosquitoes in both of your cases. I know we learned about mosquito droppings, and I guess you kind of do where cases occur and mapping, and it's a big public health effort. But is there any technological inventions or innovations that you can do to potentially ease the tracking process?
Wim, Cyril, who would like to go? Thank you, Wim.
Yes, interesting question. Tracking mosquitoes and using tracking devices, I'm not aware of that, but of course that's something that we try to do, more and more. And I think you see that you also, you don't track your mosquitoes, but you use citizens to track your mosquitoes, and that you use and you refer to many more eyes than just the entomologists to collect mosquitoes and to put traps everywhere. And an example is what we are doing with the tiger mosquito in Belgium, which is very much based on citizen science, where we then as experts will try to confirm notifications. So that's one way. Other way is that there are traps, more and more traps developed that also can count mosquitoes, can identify up to genus level mosquitoes, so that in a more real-time way you can follow the populations, and the populations build up of the traps where you place them. So these are for me two examples that do exist. We are also trying to see how we can use this type of inventions to, for example, in the context of Rift Valley fever, how we can also give traps to people moving around with their cattle to see how we can also get a better view on mosquitoes, where the actual animals are, where the people are, and where they are probably bitten by mosquitoes. That's for me a little bit what I see now as inventions, both technologically, but also using everybody who is there to help us to track mosquitoes. I don't know, Cyril, if you have additional points to add there.
Thank you very much. This was already quite insightful. Cyril, go ahead.
Yeah, I think you covered the most things here. You can use mark and re-release capture type of technique, but usually it's like in a small scale. You're not going to track them over long distances. It's quite tricky for the mosquitoes. There's new technologies I think you can use. You mentioned some of them. They developed, I think in Rome, if I remember, they got a new trap system with camera trying to identify the mosquito automatically. They got like prototypes they put in different places. The British and the Americans also been using sound, trying to detect mosquitoes. It's tricky somehow, because depending on the sound, you accept the genus. It's not that straightforward, but you can make the difference between an Anopheles and an Aedes, but it's going to be tricky to find the subspecies level. So there's new technologies helping us, and you mentioned also citizen science, which is spot on because it's a big, powerful thing. I think there's a project in Europe called Mosquito Alert, ID Alert, and they've got a huge database of citizen science points. The issue is like you always need an expert at some point to double check before it goes to a database. And then us modelers can try to play with the numbers and try to figure out things. So that's always, citizen science is powerful, but you need some level of expertise still at some point in the process. But it's helping us also with the data set collection. It's extremely helpful.
Thank you. Any questions, comments from the virtual space meanwhile? We can't see any hands on our screen, so probably not. If I might add a question to this tracking of animals. We see a lot of changes in the biodiversity, in particular through invasive species. Does the intrusion of invasive species which are not theoretically supposed not to be part of the ecological system, is there any relation to climate change here too? Because it's nature, it's animals, but they're considered to be potentially dangerous. Is there a connection to climate change here too?
Yeah, maybe I can comment on this, but specifically for the Asian tiger mosquitoes, there are many invasive species where I don't have much information. But if you look to the invasion of the Asian tiger mosquitoes, for me, it's in the first place trade and travel, and that. We saw this also with Aedes aegypti during the slave trade, where the human activities really moved these animals from one place to the other. And then they found a suitable environment where they could thrive. That's one, and that's true. And I think that's a very important driver in what we see now with invasion of vectors. For Belgium, for example, and that's a recent publication where we saw indeed that the establishment or the likelihood of establishment is increased when they arrive in a year when it is warmer. So in that sense, yes, climate and climate change will help to ensure that the species that get introduced can establish. On the other hand, we just also published something on Anopheles stephensi, where we say that in fact the climate change there, probably the climatic envelope, I don't know, yeah, Anopheles stephensi is also an invasive Anopheles species coming from Asia to Africa, but the climate envelope in Africa was already in a good shape for this mosquito species. So there probably climate and climate change did not make a big difference. So I think it's very much dependent on the species you look at and the area you look at and the regions you look at.
Thank you. Any comment from Cyril probably on this topic too?
I think Wim nailed it again. If I want to make it short and simple, climate kind of set up the background. We thrive in a specific environment. So let's say you're a human being, you're in shorts and you get teleported in the middle of the Sahara, or in the middle of Greenland or Antarctica. You won't survive very long. It's the same for a mosquito, okay? Depending if you ship those mosquitoes to Iceland, you might find some now with climate change, but usually they don't survive very long. On the Sahara, you won't find many pests. So obviously it sets up the background, but as he said well, and especially for stephensi, I think globalization, and we move things, we've always been moving things across the planet for those species, and it makes a big difference. There are exceptions. Migratory birds, they travel long distances and they're already impacted by climate change. There's fantastic work done by ecologists in Germany, the Netherlands, Sweden, showing that they change their routes, they settle down, they change their seasonality, so they might brought ticks and parasites also on long distances, the birds. So you can find ticks biting around their eyes, and they can travel long distances. If the ticks make it, the ticks might get into a new place, and if the tick like the new place, it must settle down. Well, it's more or less the summary. Okay? If you like the place and you kind of thrive, you survive the winters, you're gonna settle down, and if you thrive in that specific environment, you're gonna be there causing problems. Anopheles stephensi is an excellent example. It's been brought from India to Djibouti, I think, originally, and I was talking to the one of the person responsible for the national malaria control programs in Djibouti, and it's a terrible mosquito because one, it's very adapted to urban environment. So you know that malaria in Africa is mostly it's more in the countryside. It's not just in cities. You have less problems in cities, even if you got problems in slums in very urban areas. But this one is adapted to the cities. Is adapted to the city, and on top of that, it's also highly resistant to insecticide. So it's a very nasty problem. Once he made it to Djibouti, he just used the opportunity of all the trucks. I think he told me that thousands of trucks departing all over the region. It's been itching, like Albopictus been itching basically in Europe, has been following the cars on the motorways. That's why in English, put the traps on the motorways to double check where things might be, or if they've trapped eggs or mosquitoes. So this one is going to be an issue, and I agree with him, in fact, that sometimes it's not necessarily climate change. Sometimes the background is already suitable for the species. We need to remember that Aedes aegypti in Europe used to be there for centuries, shipped with, let's say, the merchant ships, the wooden ships. They used to love wooden ships. And they used to be in all the outbreaks of dengue, yellow fever you can find in your history books. You'll find all the big port cities in Southern Europe, more or less. So it's not new. So one is climate might already be suitable for something to invade a place, but then with climate change, obviously, those areas changes. And to summarize it, moves up in latitude and in altitude. On average, let's say, it's very subtle depending on the species or the pathogen and the vector you're looking into.
Okay, thank you very much. We have a question from, I saw the name Brigitte, and the surname I couldn't remember. So please ask a question and switch on your camera, please, so we can see you.
Hello, everybody.
We can see you. Wonderful.
Okay, my name is Brigitte Motoni. I'm a researcher at a PhD student at UC Louvain and University of Rwanda. I'm currently in Rwanda. So thank you, everyone, for the wonderful conversation. I have a question to Wim, because he has worked mostly with African countries. So based on your experience working across African countries, I'm curious to know how prepared are national and regional institutions in Africa. Are we prepared enough to implement One Health approach? Are we far away? Are we progressing? What do you think is the next important action for these African countries to implement One Health approach? And another question is, in raw resource context of Africa, with the community that you have worked with, do you have some examples on some actions the community are doing despite raw resources to mitigate the effect of climate change on plant health, for example, agriculture and human health? Those are my questions.
Okay, thank you very much for your questions. The one is very general, the other one is a little bit more specific. I think it's a question for our three experts, and we start with Caroline.
So thank you very much for the question. I think regarding human health in Africa, we ourselves have a project there where we're looking at African indigenous vegetables and how we can promote those as a source of various micronutrients, because we know that there's strong micronutrient deficiencies there, and they particularly affect young women and children. And we know that these effects of malnutrition can be life-changing. Some of them can be irreversible. And so this is one thing I would say that is ongoing right now, to try and salvage locally the products that exist and benefit from their nutritional composition that they can offer in terms of targeting hidden hunger and those problems. I think, though, that your question was also a more general one for the other experts on the podium discussion about how the countries in general, how prepared they are. I think that's one thing that I will revert to my colleagues to answer.
Thank you. Now back to the table in Louvain.
So I will start asking to Wim, as the question was, let's say, directly addressed to him, but then Cyril can expand on anything if needed.
Yeah, thank you very much. Yeah, on the first question, prepared they are. I think it's, if you look to One Health in a One Health approach, is actually the multi-sectoral collaboration. I don't think it's very specific, not a very specific problem to African countries. I think we are all have problems on to see how we can get a multi-sectoral collaboration established. So, and I think that's one of the challenges there. We are organized in silos. How can we bridge these silos to make sure that we can collaborate, that we can share data, that we can advance on this One Health, and making sure that we incorporate a larger view on health if we are tackling, for example, a vector-borne disease. So I will leave it there for a very general answer to that question, and because I don't have very specific answer to that for example, African countries. Back to Louvain.
Thanks. Well, I can feedback on you, but I can feedback on the question because I've been involved in recently with a global with Swiss TPH and others, colleagues and people from working from consultancy and others on a global fund initiative. So one thing is, I think one of the most important thing in the end is money. If you want to control disease or if you want to solve a problem, you need means, you need finances, you need persons, you need capacity building. And all those things vary a lot from country to country in Africa. And initiatives are in different stages. So I don't want to give good points or bad points on a country, but I can give you two examples, very applied examples I was involved in. I went to the Ministry of Health and talked to the programs. I was in early February. For instance, Senegal, they're progressing fast. The Med services are working with the Ministry of Health. They've got agreements to share data with Pasteur Institute. So there are initiatives in country and it's progressing well, let's say. But if you look, for instance, Burundi, they're doing a lot of things. It's good, but there's no similar agreement across the ministries and across in terms of, let's say, multidisciplinary work, even if there are initiatives by Enabel, driven by Belgium and other institutions, Blue Square, Bill Gates, etc., etc. So I think how well prepared, it depends on the country. For instance, DRC and Congo, it's a massive country, it's a continent in the continent. And the National Malaria, I was talking to one of the gentlemen who works for the National Malaria Control Programs. Basically, the work you have to do is almost impossible to control malaria across such a large country, forested areas, there's tensions, and you got limited amount of money. So I think the finances is a big, the finance and also the drive from the government and the way you structure things and the capacity building component is key. And there's a big variance in between what's happening in South Africa, down to Madagascar, up to Kenya, all the way to Ivory Coast or, I don't know, Angola. So there's a big variability within Africa, I would say. But there's good initiatives too, purely Pan-African initiatives like the African CDC. It's a good initiative. They're doing things, they're having forums, they're exchanging ideas on malaria control, they're sharing expertise. So that's also something very good. There are other initiatives. There's a lot of One Health initiatives, different funding bodies. But I think now the situation is a bit gloom because if you get back to the geopolitical situation, a lot of people are putting money away for all sorts of reasons. The Americans removed a lot of money with USAID. The French, German, British government are putting less money into the global fund. So obviously you're going to have to fill the gaps into potential external funding but still money, so which means then you can fight against problems. When you got more means, you can buy more hospital beds, you can train more nurses, these kind of things. So I'm not sure if that's answering your question, Brigitte, but it's very varying from country to country. In Rwanda, it's not bad. I mean, there's some issue. When I was in Rwanda with colleagues from Expertise France in December last year, I think things are progressing. There's good progress in many areas. But there's also a new problem to climate change in Rwanda, where the malaria is moving a bit to the colline. It's moving up a bit in altitude. So there's some instances. It's not as bad as the southern part of the country, where it's always been endemic as more cases. But you can see also in those altitude countries, things are moving up. So it in Burundi, Rwanda, you see it in Ethiopia, you see it in different places. So you see the impact of climate change already on malaria mosquitoes on the continent.
Okay, many thanks for sharing these insights with us, these informations. I saw Jean-Philippe Ampana wanting to raise a question.
But I think, thank you, Pascal. I think there was Camilla first, so I will speak maybe after Camilla.
Okay.
Camilla is raising her hand as well. So.
Okay.
Hello, everyone. So I'm Camilla. I'm a PhD student at Paris-Cité, and I'm supervised by Jean-Philippe Ampana. And my question is about vector-borne diseases. I'm Brazilian, and we have a huge problem with this, especially dengue, chikungunya, and Zika. And I know there are many programs in terms of sensibilizing the population and how to avoid these mosquitoes to be born. And I remember during my childhood in my life that we had community agents come to our houses and everything. And now I know that we just included a vaccination for dengue in the national program, which I think has been quite successful. But I was wondering in terms of the European context, if there has been already some public policy to also sensibilize the population if the burden of vector-borne diseases here is already high to this extent too.
This is a question addressed to Wim, probably. Cyril?
Yes.
Yeah, I think I can reply to that. Indeed, dengue, chikungunya, Zika is a problem in Latin America, and I think the last years, especially 2024, 2025, was a large dengue season, probably linked with the El Nino phenomenon. And what I see indeed is that your community participation to what we call then source reduction, to remove breeding sites, is for me a first step in the fight against these diseases. It's also something that we try to pilot in, for example, DRC, to see how we can involve communities in reducing breeding sites for mosquitoes. We are also testing this in Belgium, close to Antwerp, where we live, to control Aedes albopictus. So I think for me it's a first step, and I think there are many countries that are taking initiatives to really push and to involve communities in the fight against vectors and vector-borne diseases. And I think for me it's really the first step and a condition or a prerequisite, let's say, before you can do something else. Having said that, it's also one of the difficulties, because it only works when everybody is collaborating and when everybody contributes. So it's also a way of how can we motivate communities, what is their view on the disease, on the vectors, how do they perceive that? And this is information that we need to have. So in the study that we have done here close to Antwerp, we had a sociologist involved to look exactly to these questions. Are people willing to participate? Are people willing to continue to contribute and to pay attention to larval breeding sites and to reduce mosquito breeding sites? So for me, in conclusion, I would say yes, it's a first step, but it's also a difficult one, which involves much more experts, and not only the medical entomologists or the clinicians, but also people in science and social sciences.
Okay, health needs the social sciences too, in conclusion. So, Jean-Philippe.
Yes, thank you, Pascal. So good morning, everyone. I'm Jean-Philippe Pampana. I'm the academic director of the Global Health Hub in Circle U, and I have the chance and the pleasure to work with Pascal, Pietro, Emma, and also Jürgen, who is I see online. And I'm in Paris, where I lead a research unit on cardiovascular disease epidemiology and global health. So I would have two questions. The first one, I wanted to know whether there have been some estimations on the excess risk related to climate change. To climate change. My point is that I think when you want to discuss with policymakers, you need to provide some numbers, and so to be even more specific. And I wanted to know whether typically, if we take the example of non-communicable disease and, for instance, cardiovascular disease, do we know, are there any estimations on the excess number of CVD events, for example, that have been occurred over the last 5 years related to this climate change? And we could say the same thing maybe for some infectious disease, because I think that, again, to my view, it's an important metrics to discuss with policymakers when it comes to take political decision. And my second question is completely different. As you may know, Circle Alliance is also dedicated to education, teaching, and it has been, I think, introduced during the talk. We said that there was maybe not that much teaching activities related to climate change or to global health. And in fact, realize through this open conversation that there's, of course, a intersection between these two topics. And so I was wondering whether you, in your respective university, and this is a question related to the lecturers, whether in your respective institutions there were already some specific teaching activities on either global health or either on climate change and on these two intersections. Thank you.
Who wants to start? Caroline, probably with the latter question.
Absolutely. Thank you for the question. So the second question regarding teaching activities, yes, we have these. I would say I'm thinking about our institution, we integrate this into the current lectures. So if we talk about the health benefits of nutrition, we'll focus on plant diets and the benefits that plant foods provide, whether it's micronutrients, phytochemicals, for example. And so from the sustainability perspective, when we look at plant diets and sustainable diets, it's integrated in that sense into the lectures. I can't really speak for other departments, so the answer is sort of more localized.
And if I made the target audience in your activities, the target audience, is it for a specific faculty? Is it trans faculty or?
It is the agricultural students in training, coming from very different backgrounds, whether it's horticultural, agriculture, the economics area, so it's a varied background. It's also across other universities. I teach in multiple universities, so it's medical nutrition, dietetics backgrounds too. So it's broad, I would say.
Thank you.
But you're not teaching to medical students?
Not yet.
Okay, we'll get there. So, our round in Louvain to answer the first question, please.
Yeah, I think I can take the first one. So the question that you've been asking, Jean-Philippe, is about detection and attribution. That's a field in the climate change studies. So it's run on a regular basis for disaster. Let's say there's been a fire in Canada, or there's been Bordeaux burning, and we check if climate change make the event more likely. So there's all sorts of techniques and modeling thing you can use. Climometer, in Saclay, they're using that. Oxford got other metrics, the Americans got other metrics. So that's done on a routinely basis for, let's say, catastrophes. But for health, it's kind of moving slowly because for detection and attribution, you need long time series. You need to get the background, so before, after climate change. And that sometimes the data is limiting this kind of analysis. So it's been done for mortality related to heat, for instance, because in America, they might have mortality data in New York that encompasses century. So you can check, you got very nice data. You can play with it, model it with climate change, without climate change, see if there's an impact. So there's some examples on that. There's been some interesting study on West Nile that's been done by in Europe, looking at mentioning that the West Nile expansion in Europe is clearly connected to climate change effects. But if you do so for NTDs, I mean, you're thinking about NTDs, cardiovascular problems, and so it depends on the core data you got in your house, let's say. You need a big database to do this kind of thing. And you need basically the background, so before, after climate change, to make sure that you got the baseline clinical, epidemiological, entomological data you need to assess those long-term trends. So it's a difficult question. Actually, but we're working, the community is moving on it. I'm involved in a project right now, looking at those things for malaria in Africa, for instance. So we're trying to get old data sets, trying to see if we can detect some recent, you can feel it with the nose, but then there's also all the mathematical framework you need to respect and all the rules to make sure that you really extract this signal. I'm also aware that the global burden of disease in Washington, they do all these big GVD papers on a yearly basis for all sorts of disease, for morbidity, mortality. They've got a climate change team now. They're moving on to this issue too in Washington. So that's work in progress.
Yeah, thank you. I know it's a challenging question, but I think you would agree that even beyond politics, I think it's in the current context of fake news. It's very important even for the population to give when it's feasible, but to try to give some simple metrics just to highlight that it's a huge problem. And maybe you mentioned the global burden of disease, which is essentially based on risk factors at the individual level. Maybe in the short future, climate change will be considered as a risk factors or risk marker for several diseases. So that was the sense of my questions. But thank you.
Okay, thank you. I saw Selina Graf wanting to comment on a particular issue, or just sharing the paper. Selina.
Yeah, hi. Yeah, actually, I just wanted to share the paper after Brigitte asked her question. This is just a reference to a colleague, Maureen Nabatanzi, because she's doing, this is actually a bit not her current work, but we did a research project together that was based in Uganda. And at the end of the project, we did a little, we called it a dissemination trip. So visiting our field sites where we collected our samples and also talking to local policy institutions. And because Brigitte asked for the One Health approach. And so my personal impression was that everybody knew, I think even more than in Germany, for example. So because I'm based in Berlin. So I was very positive that everyone knew about the One Health approach compared to Germany. But this was just a short insight into, we were just in one region in southwestern Uganda. So, but because she asked about the One Health approach in Africa.
So probably in other parts of the world, people live the One Health approach already, probably without knowing about the overarching concept. Okay, so there's another common question here in Berlin.
Yes, just picking up on Jean-Philippe's fake news comment a little bit, I wanted to ask Professor Stokes one more question. Based off of your research and your experience with nutrition and dietetics, have you found to be able to debunk any myths that exist or that people believe are true, looking at the different substances that you can supplement, or keto, paleo kind of diets in that sense? I'm thinking if I'm a future physician and someone comes to me for nutritional advice, of course I can contact nutrition, and then that's probably the best way to go, but also just from a personal interest, what can I advise in those moments?
Thank you. That's a really good question. I think I'll pick on the one word that you said, and that's supplements, because there's a lot of TikTok videos and a lot of fake news out there about supplements and mega doses of this supplement can help with this or that. And I think we always have to just bring it down to the logical approach and say supplements can be useful in certain situations, but they can also be dangerous because we have things like fat-soluble vitamins. They're stored in the body. They can build up quite quickly over time, and there can be toxic effects. And just because something is semi-natural, it doesn't make it necessarily safe. And so that's the first thing we have to think about is what I'm doing safe. And I would urge anyone who's listening, who hears such videos, to always think, let me check with another website, let me just verify something before I do it myself. There's a lot of websites out there, national nutrition societies. You can find a lot of information. Please verify before you take on something like supplementation, which is not being overseen by a healthcare professional.
Are the risks for the microbiome basically, or just a follow up on that? What risks do I understand that if you over supplement certain the homeostasis within your body kind of decreasing, but specifically looking at your gut microbiome, which I know you focus on a lot. What are the consequences of some of these tasks?
Do you mean like probiotics or? So some probiotics can be attacked by the acids going down, and then they may not have a benefit. So we need to think about the products. Some of them can be dangerous in certain conditions. If you have infants with some gastrointestinal trouble, this could actually be dangerous. I think it's always good to research. Always, think about your personal health, any conditions you may have, existing conditions. Think about the product. Has the product been tested? Another really important point with products out there, supplements are not regulated the way medicines are. And so the actual quantity of a supplement, the dosage, may not always be exactly what is stated on the package. There are errors that happen. We've seen life-threatening results from this. Conditions where infants have died from a supplement that contained much more of the particular dosage than specified. So because they're unregulated, we need to think about what we're buying, where we're buying it from. Things also like probiotics. Does the company have a good reputation? Is it checking the products? We have things like contaminants, environmental contaminants in our products, potentially that could do us harm. Are they checking for these? Do they have certificates? It's really good to research before you choose to take something.
Okay, thank you. May I add another question to the microbiome? Because it's heavily investigated in humans. Do we have any significant research on the microbiome of animals? Animals that we eat, probably, if we eat meat? Is there anything which comes up at the horizon that it's also probably interesting to look at animal microbiomes?
Absolutely, this is a very good question. The first thing that comes to mind is the use of antibiotics, because we know that antibiotics can kill the microbiome, they kill the good bacteria, and they can enable the pathogens to multiply. And so if you have animals that have been given a lot of antibiotics, which sadly is often the case, this is compromising the health of the animal, and then the health, the quality of the meat, which in turn that the humans eat. So it's also, if we think about resilience to disease, a healthy microbiome in an animal can help them live a healthy life and be resilient against any diseases, environmental insults, a lot of these things that we've spoken about today, infections, pathogens. So indirectly, I would say there's a very strong link in terms of the microbiome to the animal. I'm not sure I could give that a fair answer. I'm not an expert in the animal microbiome, but I would imagine absolutely the way it affects us humans, it will have absolutely the same impact in animals.
So it would be worthwhile looking into the microbiomes of pigs and cows and... Okay, good. I've never thought about it. It just came up to my mind that this may be of importance as well. I think we are coming not closely to an end. And could we see, because we're still seeing Selina Graf on the screen, I would like to see Louvain on our screen.
Maybe if we speak
Yes,
English.
now we see you. Okay, very good. For the last round, I would like to suggest that Emma and Anna, our two students on the panel, asked or would like probably ask a final question, probably more related to their own fields, which is psychology and medicine. Emma, you're not prepared, but you are...
I don't necessarily have a question because I don't think anybody is has specific knowledge in psychology, but I think that I can give maybe a conclusion to everything we've spoken about, in the sense that even in psychology we can see that climate is impacting mental health, especially in young adults and children with the increase of climate anxiety. So I think that this is something that I'm learning in my education, since I'm doing a master's in clinical psychology. And it's probably something we're going to see increasing over time. So I think it's interesting to see that the parallels and that health is a very broad subject. And as you even said, Wim, that it's linked to social sciences and sociology as well.
Okay, thank you. Anything the table in Louvain would like to add? Louvain/Antwerp.
Okay, I can do like a quick thing on the psychology side of things, because it's very important in the end. It's all down to psychology and behavior, everything. You mentioned already you mentioned the mental health issue. I think there's a lot about PTSD, especially when you talk about climate extremes. People survive flooding, people survive burning, these kind of things. So that's a massive important thing. One example, completely random. I was talking to an ex-Ministry of the Environment in Burundi, a very wise man. And he's trying to look for money. So I'm doing some publicity, I can send it offline, to get some funding to set up. He's actually trying to set up an hospital for people who suffered from mental health issue connected to climate change. So that's just one initiative. It just tells a lot about what's happening down there. Very wise man. Second thing so I think someone in Normal Superior in Paris is working on that. I don't want to give a name, but in the end, if you want to do something about climate change, you need to change behaviors. You get into the mind manipulation things, how you make people behave in such a way that they're going to respect the environment. They're going to emit less, because the governments can drive things, but in the end, it's down to every individual on the planet. And that's basically key in what's going to happen next. Because if you don't change that, we don't change our mindset, we keep going the way we go, it's going to keep happening, and it's going to keep going the same direction. And you'll see what's happening now with the geopolitics, just 20% of petroleum or bits of gas, how it changes everything on global scale. So basically, that's psychology's got a big role to play. Behavioral sciences, cognitive science, social sciences, extremely important in the fight against climate change. You need to change people's mind.
Okay, so it's all psychology in the end. Well, not only probably. Any other additions from the Louvain table? You have already your 12 points, by the way.
I think in Louvain we are set, unless Wim want to expand on that. I may have a final question related to still society, etc., but I can just skip it, so we can go on and towards the closure.
Okay, so Antwerp calling.
Yes, climate change and psychology, or the health of mental, or the impact of mental health, something I don't direct have an example. The examples I have is more on how people react to new vectors, new situations, new epidemiological situations, and that for some people they are just they don't react. They say, okay, we have a new mosquito, we have probably a new situation, and others, they are just acting and reacting very as they will die tomorrow. So and I think that's also just an example to see how changes in the environment and here due to, for example, invasive species and a new epidemiological situation can change also how it can affect people and the perception of people, their mental health. But I don't have for the rest no further real examples on this, but I can imagine that this is important, yes.
Okay, thank you very much. Now we switch back to Berlin.
Yes, and also one more note on Professor Stokes' research regarding that. I think you've looked into psychiatric conditions and how nutrition impacts that, so that's very interesting as well. But my question, I think, is more based on this link to education and one of Circle U's missions, knowing that currently, yes, you don't teach medical students yet, and I don't know if our other guests do or don't, but if you were to organize or structure a course based off of your expertise for medical students, what would that look like for you? What would you like to teach them? What would you like us to know going forward? So far, we've had one course on nutrition, which was excellent, and we loved it, but we haven't talked about climate change at all so far, but I'm also in my second semester, so that might come. But yeah, I'd be curious, what course would you like to teach medical students?
Okay, that's a great question. So before moving to Berlin, I was regularly teaching medical students. I'll maybe touch on that and then adapt to the question. So always the basics. We need to teach the absolute basics of human nutrition. I think we need to think about the current shift in the foodscape, where we have a very high amount of ultra-processed foods. We need to think about how specific diets influence our health, the typical conditions and diseases associated with this. So I would like to teach the students about what to look for when these patients come through your door with these symptoms and these signs. This is what we can look for. Let's catch it early. Let's try and prevent. The goal always has to be to prevent people from getting sick in the first place. And I would teach about the kind of diets that we should be promoting. Somebody mentioned behavior change. It's such a tricky area. It's sometimes not enough just to give people the advice. You need to work with their psychology. We're bringing in the psychology to this. You need to work with the person in front of you and decide the best way that they can handle the information. I would have that also in the teaching. And maybe a final address to the previous question about psychology. I'll bring it full circle back to the microbiome and say that our gut microbiome is referred to as a second brain. There's a very strong link between our gut microbiome and our psychology. So depression and anxiety, and studies can show that we can alter this with changes to the microbiome. And I think these are the kind of things I would include in the teaching to make the medical students aware of how much potential there is out there with things that are very empowering to people, because it's something that they can do for themselves and then for the climate too.
Okay, thank you very much. This was the reference to teaching, which is one of the key missions of Circle U. And to put this into practice, I would like to add, from my perspective as a doctor, we need new generations of doctors who are aware of the broader picture of health and disease, not just look at the individual patient, but also at populations and how our populations, entire populations, may be affected, but also educated in a non-paternalistic way to change behaviors, maybe. So, we are coming to a close. We, Pietro and I, who are the conveners, and Marcel Robichon, who unfortunately couldn't be here. He's the academic director of the Climate Change Hub. We would like to thank all the panelists, all the participants, all the students, panelists, everybody in the room, in the virtual space, to have been present here today for an experiment, so to say, to have a European round across Europe, talking about one planet, today's Earth Day, one planet and one health. Are there new ways to think about medical thinking altogether under the auspices of climate change? I think it was very inspiring. Thank you very much to all of you to take your time. And I have to admit, I was a little bit uneasy because when we came here, we heard that the current may be switched off at an unexpected time. Could have been during this 1 hour and a half. It did not happen. So we are all lucky, and I wish you a pleasant rest of the day and enjoy the sun, if there's sun where you are. Here in Berlin, we have fantastic weather today. Thank you very much. Bye-bye.
Thank you very much. Bye from Louvain as well.
And thank you much for the technical teams too, both in Louvain and in Berlin. It was highly challenging to all of us.